can OT really address challenging behaviors, similarly how ABA or behavior modification use a certain thing? Can really OT help in reducing challenging behaviors, or because how you were saying that it does help navigating the impulses and the senses, can it really help with challenging behaviors directly, indirectly?
Yes, yes, I'm very sure. I'm very sure that OTs do a great contribution to improving challenging behaviors. I personally even presented a paper in a autism conference on the effect of occupational therapy on self-injurious behavior,
Right.
and it was very well received. And because it actually happened many years back, I think almost 15 years back, and uh, it seemed like that the parents were able to connect to the fact that the self-injurious behaviors may not be really only because of the behavior problem. Your sensory systems might be so dysregulated that the child might be trying to compensate for the dysregulation, for the chaos inside you, by doing these things that ultimately lead to some release of chemicals or neurochemicals, which has been proved also now, that can bring in some sense of regulation and control. Remember that with all of us, even with regular so-called normal people also, when you are frustrated and when you are upset and when you are angry, the typical responses that you might have in whatever milder or major format is about either doing this, or maybe banging the table, or maybe just throwing a cushion or a pillow down. And that tells me that we are wired in a way where whenever there's a dysregulation, whenever there's stress, whenever there's anxiety, whenever there is frustration, you might end up using certain physical ways, and that kind of brings in the regulation back to you. The OT's role here is to identify if there is a sensory dysregulation happening, what could be the possible triggers for it. Is it anxiety? Is it frustration? Is it my temperament? Is it the child's temperament that is affecting him? The child's brain with autism might be a little different than us, but also very similar. It might be different in terms of precision. It might be different in terms of intensity. And then because of the intensity that they have, they might have certain responses that we all do. Like I gave you an example of frustration and all in a little more exaggerated way. And that tells us that if we try and improve the self-regulation, the sensory modulation that we call it as, if possible to make it a part of the child's routine, if possible to make the child trained to do it by himself, maybe at a little older stage, then it does help children with challenging behavior. Young children, as young as 18 months to 2 year olds, bite their mothers or pull the mother's hair whenever they are frustrated. And OT can at least help the mother understand what's the connection between hair pull and the amount of sensation that your muscles and joints are getting out of it. And then create a substitute, either as a form of an activity or task, or as a form of some substitute where, okay, if he's pulling mother's hair, can we give him a doll that has long hair? So that it doesn't come to a person, it rather comes to an object. So OTs have a huge role in self-injurious and challenging behaviors.